Spinal immobilization begins with manual immobilization of the cervical spine and continues with application of a cervical collar. The cervical collar supports the head and neck, maintains neutral alignment of the cervical spine, and reminds the patient to keep from moving his or her head and neck. Spinal immobilization is not complete until the patient is secured to a spine board with the cervical collar in place. Spinal immobilization should be considered anytime a patient sustains a significant mechanism of injury, complains of head, neck, or back pain, suffers soft tissue damage to the head, face, or neck from trauma, or exhibits an altered level of consciousness without explanation. The KED, or Kendrick extrication device, is a commercial short backboard vest device used to immobilize the spine of a seated patient found in a vehicle, chair, or other location. The technique may be applied to patients injured while seated, such as in a motor vehicle collision, or it may be indicated for patients who end up in a seated position after the injury occurs. For instance, the victim of a motor vehicle collision may get out of the car to assess the damage, then return to the driver's seat to wait for an ambulance. Another patient may fall at home, climb into a chair to rest, and find the neck or back pain unbearable, so then calls for help. The KED should be considered for stable patients who present seated with a possible spine injury or complaint of neck or back pain, and especially when the patient will need to be lifted up out of a location such as a ditch, well, vehicle, or other confined space. Begin the procedure by taking BSI precautions. Approach the patient from his or her front. Introduce yourself, then instruct the patient not to move. Manually stabilize the patient's head in a neutral, inline position. Explain the need for spinal immobilization to the patient and be sure to get the patient's consent. With one rescuer maintaining manual immobilization, assess distal pulses, motor function, and sensory response, PMS. Apply the appropriately sized rigid cervical collar on the patient's neck. Position the KED behind the patient's back. It may be necessary to lean the patient forward to do this, however, do not move the patient by his or her head. Raise up the vest so that it fits tightly under the armpits. Pull down the leg straps, which are often secured behind the head of the device. Use the colored straps to secure the patient's torso to the KED. Fasten the leg straps to immobilize the pelvis. If needed, place padding behind the patient's head to ensure neutral alignment. Secure the head using straps provided with the KED. Reassess distal PMS, noting any changes from your initial assessment. Use the handles of the KED and hold the patient's legs to move him or her as a unit to a longboard for further immobilization. The vest-type immobilization device is not meant to lift the patient without rescuer support of the legs. The KED facilitates rotating him or her on the buttocks and then tilting the patient to the supine position for further immobilization. Once the patient is on the board, release the leg straps so that the patient can be placed in a supine position. The leg straps, when fastened, hold the patient in a seated position, making it uncomfortable for him or her to lie supine. Secure the patient's body and KED to the long board with straps, binders, or tape. Place head blocks or blanket rolls on either side of the head, securing the collar and forehead in place with tape or straps. Reassess distal PMS, noting any changes from your initial assessment. In the event a KED is not available, a very similar technique can be used with a short backboard, using straps, tape, or cravats to secure the patient to the short board before moving the patient as a unit to the long spine board.